Welcome, everyone. I am here today with Dr. Bill Osmussen, who's on my right, and he is a leader in the fluoride opposition movement. He's been a full-time dentist for over 30 years in the Pacific Northwest, and in addition to dentistry, he has two interesting other characteristics which you wouldn't necessarily know. He has a master's in public health, or an MPH, which particularly suits him for this topic because he really has a credentialed degree in public health, and that's really a significant component for how fluoride impacts our culture. But in addition to that, he has an interesting history. He's an MK. And for those of you who don't know what MK is a missionary kid. In other words, his parents were missionaries in Africa, and he grew up in Africa, I believe in Kenya, at least part of the time. And so he's got another interesting perspective and seeing life from a different perspective than most of us have had the opportunity to do. So today we're going to focus on fluoride, its impact, and some of the research he's been doing to really come to a solution to remove it from our water supply at a different level than we're positioning, but I think it's a really effective one. And he's come up with some really surprising and solid information that you need to know because of some of the initiatives that we're going to be establishing this year, and that allow you to become involved in a local community group, and we'll talk a little bit more about that later in the conversation. But welcome, Bill.
Thank you very much. Nice to be here with you.
So why don't you, I think most people viewing this understand that fluoride is believed to be useful to protect against dental caries.
I promoted fluoridation for 25 years, and over the last about 5 to 8 years, it was really under the coaching of my patients. Said, Bill, you need to look at the science on fluoridation once again. The research on fluoride is mixed as far as benefit. If you look closely at the studies and you combine them all together, I'm convinced that if there is a benefit, it's no longer there, in part because we're ingesting too much fluoride. So that even if a person says, yeah, I believe in fluoride and I think it's wonderful, it reduces decay, you have to start looking at how much should we get. And I was looking down at this basket of toothpaste, and I said, okay, Bill, you're a nutritionist. You got your master's in public health and nutrition. What does it say? So I reached down and I picked up, and it wasn't this one. This one I got from the hotel as a gift at the hotel. And then I started reading the label on it. And keep out of the reach of children under 6 years of age. Okay, that sounds reasonable. And adults apply a pea-size amount and contact the poison control center if you swallow. Hang on a second, hang on. How much is, so I just took off the lid. I started doing pea-size amounts, put it all on a piece of paper, calculated out what it was, and oh my goodness, a pea-size amount. Now they're talking about a baby pea, because I did a regular pea and I came up with half as much. But what they're talking about is you can probably see it on here. Oh, that's too much. That's about the pea size that should be used. A tiny, tiny baby pea size of toothpaste, because you're supposed to get 150 brushings out of something like this. Well, you know, when you see advertisements of it, you're going to see it, and they're going to have it like this, and then they're going to get that Dairy Queen little curl up at the top there. Ooh, now I've got my Dairy Queen ice cream cone. But that's nothing like what you're supposed to be doing. That's not.
That's a week's or a month's worth of dose, right? Isn't it?
No, more than that.
That's more than a month?
More than a month. Oh, absolutely.
Yeah, let's get a photo on this. This is more than a month. The one they use for marketing illustrative purposes is more than a month's worth of toothpaste as you're supposed to use according to the label instructions. And if you don't believe us, read your toothpaste or go to the store. If you're smart enough to not have this in your house, go to the store and read it.
Yeah, it's absolutely. Now, the FDA permits variable wording, but that's basically what's there. Well, that in the research literature works out to 1/4 milligram of fluoride. This water here happens to be Chicago water out of the faucet. This contains 1/4 milligram of fluoride. There seems to be a disconnect with me there. Okay, they tell me not to swallow 1/4 milligram of fluoride in my toothpaste, but they're forcing me to swallow 1/4 milligram in 1 glass of water. In China, they don't allow fluoride to be put into the water because it's too toxic and it causes damage. And so what they do is they take their waste product of their phosphate fertilizer industry and they ship it to the United States.
Which is fluoride. That's where most of the fluoride is taken.
There you go. And so we drink what they won't allow in their water. Now, if you took that same fluoride...
So are we using theirs? We're using theirs because of the cost, or do we...
We're using it because we don't make enough.
Oh, we don't make it. So we're using ours that we produce in the U.S., and we import the industrial waste from China to put into our water.
Correct.
That's interesting.
Because we're so tough, we can drink what they won't allow in their water. Anyway, and not only that, but it's contaminated. Ours is, and theirs is, with lead and arsenic and radionucleotides and aluminum and all kinds of things in it, because it's not a pharmaceutical grade what's put into the water. So this area of brain damage is so staggering to me that it's hard for me to gasp for air at times. This latest research was published by our National Institute of Health here in the United States.
NIH, which is about as prestigious as you can get for a certifying authority in publishing research.
Absolutely. And it was done by their Center for Disease Control along with the Shanghai University. The research is very, very good quality. Rarely have we done a blood serum study on fluoride and what it does and what the IQ is and the relationship there. So in this aspect, I'm not saying that everything out of China is great. I'm just saying in this aspect, their health departments have actually done research where ours have failed to do it. And that's typical world over. The Europeans don't fluoridate their water, hardly at all. Ireland does some. There is some fluoride salts, for instance, in France, but that's reduced from about 50% down to, I think it's around 20% now, so they're cutting back. The dental associations in Europe don't recommend fluoride supplements anymore. We all agree, there's no dispute on this by anyone that I know of, that too much fluoride can cause dental fluorosis and skeletal fluorosis, but dental fluorosis. Dental fluorosis is shown by little white spots in the teeth, brown spots in the teeth, this type of thing. And if it's just on one tooth and not any other teeth, then it may not be the fluoride. So it should be similar teeth that are developing at similar times, and then that would be the fluoride. The National Research Council says that fluoride is not beneficial after the age of 8 because our teeth have finished forming. Systemic fluoride. Before the age of about 1, mother's milk has virtually no fluoride in it. And so we shouldn't have it before about the age of 1. We shouldn't have it after the age of 8. So we give fluoride in the community for everybody in the hopes that maybe the children between the ages of 1 and 8 will have a benefit. So one of the concerns I have is the brain. I mean, our brain is the economic impact of brain damage. We're looking at about $500 to $1,000 per year less income for every IQ point that is dropped. When you know
it's a powerful point. I just want to emphasize it. $1,000 a year income for every IQ point.
Yes.
And you know, this is kind of not a really great economy right now. So that's going to start to add up pretty quickly.
75% of Americans now get fluoridated water, but about 65%, maybe a little bit more, have artificially fluoridated water. So in other words, fluoride naturally occurs in water in a fair amount, especially in your volcanic regions and in harder water areas. There's fluoride naturally occurring, and sometimes to higher levels where the EPA will require that the fluoride be removed or diluted with other water. So
is there a significant difference from this naturally occurring fluoride versus the one that's artificially added?
Absolutely, and this is one area that the EPA does not differentiate, and they should. Naturally occurring fluoride in hard water areas often has a calcium fluoride, which calcium and fluoride love each other. They really bond well, and it's not absorbed as well in the body. Whereas the hydrofluorosilicic acid, which is the waste product that's put into the water, that dissolves better. Maybe not as good as it should, but it does dissolve better, and it tends to be absorbed in the body more. So the safety factor, calcium fluoride, is about 1,000 times less toxic as the hydrofluorosilicic acid and the sodium fluoride. Almost
largely related to its absorption?
Yeah. Almost all of the studies that are done are using sodium fluoride and not the contaminated waste product that's put into the water. So that's one of the problems with the studies.
one of the things I neglected to mention is that you were a full-time practicing dentist. But
Yes.
you took time off,
Right.
physically took time off, so kind of semi-retired with no other benefits because as a practicing professional, your only income is from your practice. So you took time off, stopped receiving income, and committed yourself full-time to kind of like missionary work to this fluoride process. And you've done that for how long now? A few years?
About 5 years.
5
now.
years. So you're really committed to this in a very significant way, far more than most other professionals have done. So you're really a champion from that perspective. And in that time off that you've taken to commit yourself to this research and dedication and seeking to make a change at a legislature level, both either local, state, or federal, you've encountered this research, put it together, and that's what you're about to share now.
Absolutely. The studies are incredible on the reduction in success in marriage, the reduction in education. High school success is much lower, college success is much lower. When you start reducing IQ, you're going to have much more increase in crime. So do you? Yes. When we go and we compare counties, we find that there's a 71% increase in crime in counties where there's fluoridation. We look at states, we find that there's a 100% increase in crime in states with fluoridation. Where does this whole thing first start? Before conception. Because it's that sperm and that egg that are having damage from the fluoride. When they get together in the fluoridated areas, you have more Down's syndrome. We're going to know more and more in time of some of these other factors of damaging that sperm and egg. The problem that we have with nature is the fact that the fluoride crosses the placenta to the fetus, developing fetus. And so when they do biopsies of aborted fetuses, intentionally aborted fetuses, they find that, especially in China, where they will do late-term abortions, they find that the development of the brain is significantly different in the fluoridated communities and the non-fluoridated communities. I don't drink fluoridated water if I can ever help it. Do I bathe in it? I don't have any real side effects that I know of, and I still bathe in fluoridated water. I avoid it when I don't live in a fluoridated community most of the time. When I'm in Seattle, I am in a fluoridated community. I avoid toothpaste. Those are the two big, the fluoridated toothpaste. I use a non-fluoridated toothpaste, and you're coming out with a toothpaste now. I would highly recommend it. I've tasted it, I've looked at it, and looked at the ingredients. It's excellent. So that's what I would definitely use, and I highly recommend the product that you have in non-fluoridated toothpaste.
But there's others, and
yeah.
This is a good one,
and
it has special herbs that tend to enhance its benefits relative to some of the others. But the key take-home message is that you got to remember this toothbrush. That's a month's worth of fluoride, a month's worth.
Yes.
So if you like that much toothpaste, fine, but don't use the fluoridated stuff. And you just can't use it. You're just asking for trouble because invariably they're going to swallow some. It's like physiologically impossible not to swallow this stuff. And if it
absorbs through the skin.
Yeah, and if you're obsessive compulsive, I mean, and you're using this much, you've got to take your child to the emergency room by the recommendations on the label. And anyone should have the opportunity and freedom to choose using fluoride in their child. But I think you presented some very compelling evidence. We certainly provide others on the site that there is no benefit to doing this. So, I mean, you don't have them swallow it, I mean, clearly, but don't have them use the fluoride toothpaste, and you don't have to worry about this issue. But for whatever reason, if you choose to believe that this isn't true, then, and you're using fluoride toothpaste, first use 1/30 this amount and make sure they don't swallow it.